So our topic of discussion is classification of ovarian tumors and histological features. Okay, this topic is also important from MRCOG part 1 examination point of view. SBA can be asked on this particular topic. So we have a WHO classification of ovarian tumors, and this is what is the classification into 5 different categories, but 3 categories are very important. The category 1 is a surface epithelial tumor, second category is a germ cell tumor, and third is a sex cord stromal tumors. So these are the 3 main categories which are important. Okay, the fourth one is a metastatic tumors, that is the origin is somewhere else and the secondaries are deposited to the ovary. In that, the Krukenberg's is a very famous tumor, or classically it comes from gastric origin. Okay, and there are some miscellaneous tumor also. So these are the categories or the WHO classification of ovarian tumors. In the surface epithelial tumors, we have serous tumor, we have mucinous tumor, then endometrioid, clear cell, Brenner, and seromucinous. So these are the subtypes in the surface epithelial tumors. Okay, serous, mucinous, endometrioid, clear cell, Brenner, and seromucinous. In the germ cell tumors, we have mature teratoma, immature teratoma, dysgerminoma, yolk sac tumor, also called as endodermal sinus tumor, then embryonal carcinoma, choriocarcinoma, and mixed germ cell tumors. Okay, so these are the germ cell tumors. Third is a sex cord stromal cells, in which we have a granulosa cell tumor, which can be either adult type or juvenile type. Okay, then we have thecoma, fibroma, Sertoli cell tumor, sclerosing stromal tumor. So these comes under the sex cord stromal tumors. The next category is a metastatic tumor, in which we have Krukenberg's tumor and other metastases from the breast, colon, etc. And miscellaneous tumors like small cell carcinoma, gonadoblastoma, lymphoma involving the ovaries. Okay, but out of which these 3, or at the most SBA can be asked on the Krukenberg. So these particular this is what is the classification of the tumors. Then let us see the important histopathological features. They'll give you specific word, the specific description of the pathological slide, histopathology slide, and they'll ask you, this is a feature of such and such tumor. Okay, so let us see what is the main feature in that particular tumor. So if you have a serous cyst adenoma, which is benign, it will be lined by a single layer of ciliate or columnar epithelium. Papillary structures may be present. If it is a serous carcinoma, that is malignant, in that particular case you will have complex papillae, and most important is the samoma bodies. Okay, stratified epithelium with nuclear atypia and mitosis. So if they ask you about the samoma body is a feature of which particular ovarian cancer, they will give you multiple list of ovarian tumor. It is seen in serous ovarian tumor or cancer. Okay, serous carcinoma will have samoma bodies. Then mucinous adenoma, you will have a tall columnar mucin secreting epithelium which resembles either endocervical type or intestinal type. Okay, then mucinous carcinoma, invasion of stroma, stratification, there will be cellular atypia and mucin legs. That is the feature of mucinous carcinoma. Then you can have endometrial carcinoma. Endometrial carcinoma will have glandular pattern resembling endometrial carcinoma. Squamous differentiation often present. Another important is a clear cell carcinoma. Here you remember about Hobnail cells. Okay, you can take the photograph of this particular slide so that everything will be easily accessible to you. So in clear cell carcinoma, you will have clear cytoplasm, Hobnail cells, tubulocystic or papillary architecture. Okay. Then next is a Brenner tumor, in which there will be nest of transitional or urothelial-like epithelial cells in dense fibrous stroma. So characteristic of Brenner tumor is a urothelium. Okay, so transitional cell or urothelial like epithelial cells will be present in Brenner tumor. Are you getting it? The important features of each
Yes,
tumor.
sir.
Okay. The next is a germ cell tumor. We know that mature teratoma is a tumor which has got features from all 3 layers, that is endoderm, ectoderm, and mesoderm. Okay, if it is a mature teratoma, there will be all 3 germ layers like skin, hair, cartilage, neural tissue, etc. If it is an immature teratoma, there will be primitive neuroectodermal tissue, immature cartilage, bone, muscle. Okay, the most important is a neuroectodermal tissue which is present in immature teratoma. Then dysgerminoma will have sheets of large cells with clear cytoplasm, central nuclei, fibrous septa with lymphocytes. The next important is a yolk cell sac tumor, which is characterized by the presence of Schiller-Duval bodies. Okay, these are glomeruloid structure. So again, this is a SBA most frequently asked. Schiller-Duval bodies are present in which type of tumor? It is a yolk sac tumor. Okay, and reticular microcytic pattern will be there. AFP will be positive. Okay, then embryonal carcinoma, large primitive cells, prominent nucleoli, mitotic figures, hemorrhage and necrosis. Choriocarcinoma, which is non-gestational choriocarcinoma, cytotrophoblast and syncytotrophoblast will be present, extensive hemorrhage, necrosis and beta HCG will be positive. Okay, so these are the features. They can ask you in the data interpretation also. Okay, may come in the pathology or may come in the data interpretation. The six called stromal tumors, in which you have first is a granulosa cell tumor. Here the characteristic feature is a Call Exner bodies. Okay, these Call Exner bodies are small follicle-like structures, or they have coffee bean nuclei. There is a nuclear groove which looks that is why it is called as coffee bean nuclei. Okay, then thicoma will have lipid-laden spindle cells, yellow on gross examination. Fibroma will have a typical spindle-shaped fibroblast in a whorl pattern and collagenous stroma. Okay, the feature of fibroma is a spindle-shaped fibroblast. Okay, then sertoli cell tumor will have a Reinkes crystal. Okay, there will be tubules resembling Sertoli cells, Leydig cells, and eosinophilic cytoplasm, and Reinkes crystals will be there. Then next one is a sclerosing stromal tumor, not very commonly asked, so we can skip this. Metastatic tumor, Krukenberg can be asked. There is a signet ring cell or mucin filled signet ring cells appearance. Then bilateral ovarian involvement and typically from gastric carcinoma. So these histological features are going to be very important from examination point of view. That is why I have collected all these features together. Okay. So that finishes this today's topic of classification of ovarian tumors and their important histological features. Is it clear to you?
Yes, thank you, sir.
Yes, sir.
Okay, thank you.